Hello everybody, I just want to comment really quickly on how to remember the cranial nerves. I know some people may find it hard to remember all of them, but it's actually pretty simple. Just remember the mnemonic that I'm going to give you so you can remember. Remember there are 12 cranial nerves and just plug the first letter together, and I came up with O, to touch and feel a good velvet ah. Just remember that, all right? But remember that, just came up with a little drawing just for you to remember the easiest possible way. Remember, one is olfactory, it's a sense of smell. Remember, we have one nose, right? One nose. Optic, able sense to be able to see. It's a sense of sight. So what do you think it is? Number two is the eyes, right? It's the optic nerve. It's a sight, all right? Two. So remember, one, two. Next, oculomotor. Okay, oculomotor is you'll be able to see the pupil reaction. So once they light the light on the pupil, it will see either dilates and constricts. So I'm gonna go over further about these later on, but I just want you to remember that it's number three. And this case, since we're doing that, we already talked about number two being optic nerve. So we have just remember these three letters, oat. Okay, oat. Just because this able to also help the eyes to look upward. It's like an eye movement. Also, the two you'll be able, once you see laterally, is abducens, number 6, and when you see downward like this, is trochlear, which is 4. So just remember oat, 3, 6, 4. Okay. And then, so we already talked about 1, 2, 3, and 4. Now next is 5. Just remember 5. Okay, 5. This is just the whole face right here. So just remember this whole face. So it's 5. All right. What is number 5 is? 5 is trigeminal. All right. 5 is trigeminal, which means it's more like corneal reflex, movement of mastication, also able to sense sensation also. And that's pretty much what it's maybe might not make sense right now, but once you start practicing on your patient, because eventually you're going to present a assessment, head to toe assessment on a patient front of your professor, and you're going to make sure to go through all the cranial nerves. So just by remembering things, you'll be able to remember that. All right, so number 6, like I said, is 6. Okay, 3, 6, 3, 6, and 4. Upward movement laterally and trochlear downward. Trochlear is for checking perla, is be able to check the pupils also. So the pupil size, once you light, that's the light in the pupils. But that will be coming later on video, so I just want you to remember the numbers. All right, so remember 7. By flipping it over, like on the other side, would be facial. So just remember 7. It looks like an F. All right, so it's 7. All right, 7. So I just kind of let you know this is the face. So face is for facial nerve. All right, and that's by asking the patient to raise the eyebrows, to frown, to show your teeth, to smile, puff your cheeks. I'm gonna go over a video where I'm gonna go over really quickly on how to assess for each cranial nerve, and that's something that will be able to for you to remember. All right, so 8 is for acoustic. What do you think it might be? It's for hearing. So just remember 8 is for hearing. It's like the ears. All right, ears. All right. Next, let's see, glossopharyngeal. What is glossopharyngeal? It's able to, it's a sense of gagging and actually swallowing. So just remember, it's the area of the mouth, right? So it's 9, and 10 will be what you think is vagus. So vagus is for the uvula. Just kind of remember, like, the way to remember, you may think, how am I going to remember 10? I just think of like uvula is a U, right? So just remember uvula, all right, or vagus. So it kind of looks like a U or V. So just kind of remember that's vagus, number 10. And number 11, what do you think it is? Accessory. 11. Remember, this is the face. 11 is the shoulders. Okay, is the shoulders able to shrug, and is for actually able to move the head. So just remember 11. All right. And number 12 is hypoglossal. That's able to move the tongue, make the R sounds. So just remember the tongue. All right. So let's go back again. All right. Let's go back to the mnemonic of the cranial nerves. O, O, O. Let's all repeat together. O, O, O. To touch and feel a good velvet ah. And then if you go back, you just remember it's olfactory, right? So olfactory, sense of smell, you have one nose. Optic, you have two eyes, right? 3, remember? 3 is, remember the side movements of the eyes, O-A-T for oat. 3, 6, 4. Upward, oculomotor. Lateral movement, abducens. Downward is trochlear, 4. All right. 5 is trigeminal, is be able to sense sensation. All right. And this whole thing is the face, remember. And remember, 7 is you flip it over, the 7 of the 7 will be like, looks like an F, right? F, if you flip it. So I think you may be able to know what I'm talking about once you draw it yourself. This is for the face, for facial, 7. 8 is acoustic, the ears, able to hear. 9, remember 9 is glossopharyngeal. It looks like if you be able to, I just think of like, like a G. So just kind of have that idea in your head that will be 9 looks like a G, glossopharyngeal. So something for you to remember. That's gagging and swallowing. And remember 10 is right here, the uvula, right? Uvula, or V for Vegas. That's for 10. And 11, remember, 11 is shrugging the shoulders, head movement, help the head to move. So 11 is shoulders. And 12 is what? Can I hear? Is the tongue. All right? Is to be able to tell the patients to roll your tongue and like make the R sounds. So yeah, this is something basic and something that is helped me so much through the years, and something to remember and also teach my nursing students as well. So hope it helped you a little bit. Like I said, I'm going to go into more in depth in every single cranial nerves when you get down to your physical assessment, your patients. So once you're ready to show your professor your skills, you'll be able to feel confident enough to show. So just for now, remember the acronym and obviously the cranial nerves, and have like a have more like a visual in your head of what they are, 1 through 12. I'm sorry if this one is not so clear. So just remember all the cranial nerves, and I hope it helped you a little bit, and maybe I guess I'll talk to you soon, okay? And you'll be able to do well in your nursing school. You'll refine in anything you do. Just put your head into the gift, into the target goal, into the finish line, and guess what? You'll be done. I was done with NP school. You'll be done as well. Good luck. Bye-bye.